One of our strengths here, and really unique services, is this outpatient bone marrow or stem cell transplant clinic. I think most people hear the word bone marrow or stem cell transplant and they immediately are intimidated by what sort of procedure they are going to undergo. We will fully acknowledge that this is an intense procedure that is going to come with some significant risks, but then also some significant benefits, which might be cure or significant change in the amount of time that this disease is under control. The one thing that we used to have to tell everybody when bone marrow transplants were first invented or studied was that everybody needed to be in the hospital for a period of about a month or so. They all needed to be in what we call kind of a bubble room where they just had to be isolated from most of their family and friends. We have learned over time that we can safely do transplants without that level of rigidity. In fact, we've gone as far as to say we can safely do transplants in a clinic setting. It requires intense follow-up. We have to check on patients daily. But rather than putting them in the hospital for a month, we tell them, we're going to give you your chemotherapy, we're going to give you your fluids and your blood transfusions and do all your checkup daily as an outpatient, and we are going to give you very strict parameters for what to call us for anytime, day or night. Should there be a concern, we will get you into the hospital. So we will not jeopardize your care by keeping you outpatient. This is unique to just a few centers in the country. Patients who receive this aggressive treatment can actually do it all in our clinic, which is open 7 days a week, 365 days a year. They can come in each day to get their treatment and any additional kind of supportive medications that they need, and then go home to local lodging or their home at the end of the day. What that's done for our patients, and we've seen it firsthand, is just from an emotional standpoint, patients are in a much better state. When they get to be out of the hospital, have the freedom to walk, to sleep in their own bed, to visit with friends, to go to restaurants, things like that, they are just emotionally handling the whole experience much better, which definitely I think impacts their physical recovery as well. The other thing that we've really noticed a benefit for is that it just keeps our patients more active. Any patient, no matter how healthy they are coming into the hospital, if they're in for a month, they will lose muscle strength. They will get weaker. There is just no way we can let our patients be as active in the hospital as they would be outpatient. We had one patient who underwent a cord blood transplant, something that traditionally takes anywhere from 40 to 50 days for the blood counts to come up to be in a range where we can safely discharge a patient. She stayed outpatient for the entire transplant. So to me, it is such a huge advantage to let patients be able to preserve that aspect of their routine or normalcy when everything else is being disrupted for them.